Western Washington gets real about your voices. During Black History Month, we looked into why some communities of color don't trust the healthcare system.
Now KIRO7's Tracey Luong explains how a local dentist is changing how some children view a trip to the dentist and even the tooth fairy.
About 3.7% of actively practicing dentists in the profession are Black. Now, mind you, we make about 13.5% of the population, so there's a huge disparity in representation.
A nationwide statistic Dr. LeRoy Horton is working to change. Originally from Greece, Dr. Horton graduated from Mount Tahoma High School in Tacoma. He attended Pacific Lutheran University and the UW School of Dentistry. Today, he has practices in Bellevue and Covington and is dedicated to addressing the needs of the BIPOC community, especially those with limited access to dental care.
In the meantime, you'll let me know how life is. Communities trust providers from their own community. So if we can't have that representation in the profession, there's going to be a huge gap in the amount of trust.
Dr. Horton has seen the lack of trust lead to less frequent exams, delayed treatments, and overall poor oral health for Black adults and children. To address the issue of representation and dental care knowledge, Dr. Horton believes it starts with exposure at a young age to dental education and role models.
Hello, I'm Tooth Fairy Jasmine.
Jasmine Lomax is part of the Tooth Fairy Experience, a program presented by the School Nurse Organization of Washington and Delta Dental of Washington.
As a kid, I didn't see people that actually looked like me on TV, and I often thought the Tooth Fairy had blonde hair and blue eyes, so it feels incredible to bring a different take on what the Tooth Fairy can look like.
Lomax recently attended a Northwest African American Museum event to hand out books and dental kits.
We find it important for us to get our dental information across if they can relate to us.
You guys are doing the X suture, which is
Outside of his practice, Dr. Horton is dedicated to removing barriers for aspiring BIPOC students, partnering with organizations that prioritize STEM education in Black communities, and volunteering as an affiliate instructor at the UW School of Dentistry.
engage with mentors like myself that look like them, that come from these same areas.
Dr. Horton has also collaborated with colleagues to create scholarships and financial aid packages for underrepresented students.
Really helps entice these young, talented kids to come to the University of Washington.
Investing in dental programs that recruit and retain diverse students to ultimately increase representation and lead to better oral health care for the BIPOC community.
According to the Washington State Department of Health, nearly 1 out of every 6 third graders has severe tooth decay, meaning at least 7 cavities. And BIPOC children have higher rates of untreated decay, which can lead to chronic pain and infection. Reporting in Seattle, Tracey Luong, KIRO7 News.